This piece of research is titled, "Is abnormal immunology associated with recurrent urinary tract infections?" There are no affiliations to disclose, and the funding for the speaker to attend was self-funded. Background information about urinary tract infections, otherwise known as UTIs, includes: the population prevalence of UTIs is 11%. They are the most common type of infection in hospital and community settings. High incidence means that they have a widespread impact on society, including personal burdens, societal effects, and financial implications. UTIs can be defined as complicated or uncomplicated, and should a woman experience 3 or more UTIs within a year, she's considered as suffering from recurrent UTIs. The current literature focuses predominantly on the risk factors, management, and the role of the innate immune response in the urinary tract. Little research has been done in the association between the adaptive immune response and recurrent UTIs. This is where this piece of research is relevant. For this study, we recruited 227 women from a urogynecology clinic in a tertiary centre. There were multiple reasons for referral to the clinic. At each consultation, women had routine urine analysis conducted, as well as urine microscopy and culture. Blood immunological markers were recorded. These included IgA, IgM, IgG, and IgG subclasses. Serum diamine oxidase and mannose-binding lectin levels were recorded. If women had a bladder biopsy done, a mast cell count was performed. All of this data was then collected into a database and coded. Women were classified into 2 groups: ones that experienced 1 to 2 UTIs per year, the non-recurrent UTI group, and those that experienced 3 or more UTIs in a year, the recurrent UTI group. All of this data was then analysed using SPSS software. The results found that women in the non-recurrent UTI group had a median of 1 UTI per year, and women in the recurrent UTI group had a median of 4 UTIs per year. From all the urine cultures that were conducted, 34 different organisms were identified. 30.4% of all identified organisms were Escherichia coli. Then, when looking at individual cultures, 50.8% of all cultures had 1 organism, and 49.2% had 2 or more organisms present. It was found that having multiple organisms present in a single culture was significantly associated with experiencing recurrent urinary tract infections. When looking at the entire population and after analysis, it was found that there was a significant association between recurrent urinary tract infection status and IgG2 levels. When the population was then subdivided into a pre- and postmenopause group, this observation was found in the postmenopause group, but not in the premenopause group. This is important because it can provide an alternative rationale for why certain postmenopausal women are more susceptible to recurrent urinary tract infections. Thank you for listening.